Hey everyone, it's Dr. Russell, and for this week's video, I wanted to touch on something a little different. So, this is actually not usually a top concern that women come in to see me for, but it is a common concern that a lot of women do bring up when they're at their visit with me. So, that is hair loss. Now, hair loss can present in different ways, but typically it usually is just overall hair loss. So as you're showering or brushing your hair, you might notice there's more hair coming out. And if you're, doing your hair, putting it in a ponytail or something, maybe it just feels like there's not as much as there used to be. There can also be a change in texture sometimes. Less common, I would say, women will have patches. So especially maybe on the front or the sides, they might notice certain areas that they're losing more hair. But either or is definitely an issue with hair loss. So there are many reasons why this can happen, but the most common reasons I wanted to go over and discuss, so at least you know more on how to ask your doctor about it and get fully evaluated for these things. So first one is PCOS, or polycystic ovarian syndrome, and that can present with issues like longer time between your cycle or your period. So you might go 2 to 3 months without having a period. You have the hair loss, but you might also have hair growth in places that you don't want it. So maybe on your chest or your belly. You can present with other androgen-like traits like increased acne. So that is a very common issue, and about 1 in 10 women have PCOS. So if hair loss is a concern, you also have these other symptoms, it would be good to get evaluation for that. Then the second thing that I would say is most common is thyroid or hypothyroidism. So that can also cause hair loss. And what's interesting is that a lot of women, because they read online, will take biotin because they've heard it's good for hair growth and getting back your hair. But biotin can actually falsely elevate thyroid levels. So if you're getting the test for your thyroid because you're convinced that that might be an issue, but you're taking biotin, that might mask the hypothyroidism. So you don't really get that full picture of if the thyroid is off. So I always recommend my patients stop biotin for a little bit before we test the thyroid to really get that true picture of what's going on with their thyroid. Now, third, and this is a common theme throughout most of these videos, is stress. Surprise, surprise. So if you don't have great adrenal function and you've been stressed for years, or maybe you just have an acute episode of a bunch of stress all at once, so maybe you're moving or there's been a death in the family or a job change or all these things, and it's kind of overwhelming, that stress can definitely cause hair loss. So that is something, as we've talked about, ad nauseum, to address and use those tools to help deal with stress, and also know maybe if it is a temporary thing, that at some point that move should be done or the job change should happen or whatever it is, and the stress will go away and that things will get back to normal, hopefully. The fourth issue that I've also seen associated with hair loss is just a nutrient deficiency. So we need different things in order for our hair to grow. And my favorite thing I love to recommend to people trying to help with their hair growth is a tea that uses different herbs that are really rich in things like silica that are important for hair growth. So the tea uses horsetail, nettles, milky oat, using the straw and not the seed. They have different actions. And then alfalfa. And what you do is you let it steep for a very long time, so 12 hours overnight, and then drink that tea, and that has all the rich minerals, again, especially like silica in there, that helps with hair growth. Now, so those are the most common ones. So we have PCOS, hypothyroidism, adrenals or stress, or just a nutrient deficiency. Some of these can all happen at the same time, so it's very possible you could have PCOS and hypothyroidism and be stressed and have a nutrient-poor diet, so you have all of them. So it's good to at least just pick one and start addressing those. There are, of course, other things like fungal infections, or now we've seen post-COVID causing hair loss. So, there are other issues that can cause hair loss, but these are very, very common. And the one recommendation I always give to women, especially with dealing with hair loss, is that it can take time to get back to normal. So hair generally grows relatively slow. So it can take months sometimes to see any change. And what really you want to start by seeing is just a decrease in the hair loss itself. So maybe less coming out in the shower or brushing your hair. So we kind of get to this stable point. So that's a good first sign. And then it's going to gradually it'll start growing again. So you'll see these little hairs and maybe things starting to fill in. But again, that can take months and months to happen. But that being said, it's good to get to the underlying issue of why that's going on. So figuring out, again, is it PCOS? Is it hypothyroidism? Is it adrenal fatigue or stress? Or is it just a nutrient deficiency and you need a more nutrient-rich diet in your life? So hopefully that was helpful, and I will see you in a few weeks for another video.